Welcome back, my good people, and it's good to see you back in this channel. And I thank you, those who have been with me from the beginning of this channel and still soldiering up with me. Thank you so much, and may God bless you. Those who are joining me for the first time, kindly click this notification bell, written subscribe, turn it on for more videos that I will post. Now, today we want to talk about umbilical cord care. This is now a pediatric topic that I'm inviting you all to come and stay with me until the end of this video. It's sad to begin with that every year we normally lose about 400,000 infants due to what we call neonatal sepsis. And that is why we are asking ourselves now, what can we do? Now, WHO and UNICEF has introduced a very nice gel which we call Chlorhexidine 7.1%. That is chlorhexidine that I want to show you here. This is Chlorhexidine Digluconate gel 7.1% for umbilical cord care. This is how it looks like. And as you can see, you are seeing somebody applying some gel to the umbilicus. Now, we want to look at this gel into details, and we want to review it. We ask ourselves, is it safe? Are there any risk? And what about those myths that are revolving around the cleaning of the umbilical cord? Do they apply when you clean the umbilical stump with spirit? Those normally use powder, or even tie with threads, or even coins, or those who normally apply cow dung, or even some oil, even some cow dung. Are they making sense? Are they safe for our newborn? Now, I want to debunk these myths in this particular video and look at the truth behind the chlorhexidine gel that we want to talk about, and just to know it into details. And this is a video that is backed with the science and not hearsay. So stay with me until the end of this particular video. And if you have not subscribed to this channel, kindly click the notification bell, written subscribe, turn it on for more videos that I will post. Now, we begin by saying that we are asking ourselves, what is this chlorhexidine digluconate gel 7.1%? Now, this is an antiseptic solution that is recommended by World Health Organization, that is WHO and UNICEF, for umbilical cord care. And if you can see here, it's written for umbilical cord care. And the formulation itself is chlorhexidine, which is a very powerful broad-spectrum antibiotics in form of a gel. That its main role is to prevent the cord stump, which is always vulnerable to bacteria, and which can enter into the newborn bloodstream and cause severe infection. And we normally observe this when there's a poor sanitation, and our main aim also is to reduce the deaths of this our neonates, what we call neonatal sepsis, which normally happens every year, and it's causing 400,000 deaths every year. Now, this is available at 10 milligrams. The strength is 10 milligrams, and the tube is so tiny but so powerful. 10 grams, or 10 grams, tiny and so powerful. And this company called the Universal Corporation has really done a very good thing to bring this particular gel. Now, what is the mode of application for this gel? How will you apply it to make sure that the umbilical cord is very clean? Now, inside this particular box, there's leaflets, drug information, both in English, French, and I think this is German. And we have the steps, and these steps are very vital to help our women who have just delivered, or anybody who is taking care of the newborn. And there are the steps that I want us to follow and know how to apply this particular gel. Now, the first step, of course, is to sanitize your hand by washing before application with clean water. And after that, you are going to open the tube. After opening the tube and break the seal, there is a seal somewhere here that I do not want to break because this one will help someone. So you normally use the sharp end of this cap and then press it gently to break the seal, and this is what you will be using to apply. And after breaking it, then there is step number 3, that apply the chlorhexidine gel on the base of the cord stump and areas surrounding the cord, as shown here, and also I will show you in the pictorial and video manner appearing somewhere here. And after application, then you should be able to wash your hands after application with clean water. Now, after application, do not, this is a disclaimer, do not cover with the cloth or bandage, and do not apply any other thing. Do not apply any other thing. Some people normally apply powder and even spirit, even cow dung, spider webs, ash. It is not recommended to apply anything else after you have applied this particular chlorhexidine gel. So you follow those instructions very well, and make sure you sanitize your hands before application and after. Now, there is advantages of using this particular gel because it's very important. We'll also touch some few disadvantages. Now, one of the most important advantage is that it reduces the risk of umbilical infection. We've noted that it's a broad spectrum antibacterial that is normally helping in terms of gel. Now, we are trying to prevent any other bacteria. As you know, classification of bacteria are broad, and we have both gram-negative and gram-positive, and some anaerobes, even fungal infections that can attack this our infant, this our newborn through the umbilical stump. And we are afraid of the most severe infections coming in terms of these bacteria. Number one, topping the list in terms of gram-positive bacteria are the Staphylococcus groups, and more so the Staphylococcus aureus is playing a very important role here. And Streptococcus also, most of the Streptococcus that is topping the list here is Streptococcus pyogenes, which even may cause even toxic shock syndrome, and this one can result into severe infection. Even the group B Streptococcus, like the one which is topping the list, is Streptococcus agalactiae, which is very key in causing infection in terms of gram-positive, not even forgetting the Enterococcus species, which are also gram-positive bacteria that can invade the umbilical stump and cause an infection. Now, gram-negative bacteria topping the list is Escherichia coli, and I want to talk about this in a short minute. Just give me a minute to give you some details. When a woman is giving birth, you will find that bigger percentage normally poop. They normally defecate. They pass stool while they are giving birth, because the uterus is pressing the rectum and now the feces are coming out. And this organism, the Escherichia coli, is a prominent bacteria found in the genital tract around your genital stumps of the rectum, the anus, and when the delivery is not very, very septic, even if the delivery is very septic and the midwife is not very keen, sometimes it can pass and invade the umbilical stump and cause an infection. Even the hospital itself, we have acquired hospital bacteria which are always very, very resistant, like Klebsiella pneumoniae, and the one normally liking the most moist environment and where there are dampy places like waterlogged, when you've not cleaned your couch very well and it's moisture. Pseudomonas aeruginosa is always hovering around that place, and if you do not disinfect it very well during delivery, now the baby can even catch infection due to this gram negative called Pseudomonas aeruginosa. Not even forgetting the fungal infection, the candidas, which can affect the babies, particularly those who are born prematurely and from immunocompromised mothers who normally don't take their antiretrovirals very well, giving birth to these babies when their viral load is high. And not forgetting the key one that we normally start preventing even when the mother is pregnant, the Clostridium species. Clostridium tetani, causing tetanus. We do not want our child to get this particular infection. So that's why we highly recommend chlorhexidine gluconate, because digluconate, because it normally help to prevent those particular bacteria, and these ones can cause death even within 5 days after acquisition. So we want to prevent this neonatal sepsis, which is of course caused by those infection, by using this particular gel. And of course, it is another advantage is very easy to use, and WHO has backed us up with the use of this particular gel. Now, when you apply this particular gel, it can have some disadvantages, which sometimes is very, very rare. It can cause skin irritation, or those who are infants that are hypersensitive, and this may follow the history of allergy in the family. Some mild rashes can occur around the umbilical stump and at the umbilical area, the stump area, and when it is too much, in fact, when the sensitivity is too much, that leads to redness, irritation is disturbing your child, then you can consult for further advice. Now, do not apply this on a broken skin, and those who are allergic to chlorhexidine. And this one you will notice when maybe within 12 hours of applying this, when there's a lot of skin discoloration and persistent itchiness and burning sensation together with a rash, and your child will be restless, your infant and newborn will be restless and crying a lot. You may also check the stump to check whether there is a lot of irritation or even redness. Now, let's debunk those myths that are surrounding the use of different kinds of method, like one spirit, surgical spirit. I know some people normally use it, and they may say that they normally get a good result, but bigger percentage normally report that though the cord dries faster, but drying of the cord is not the main reason for this, because it doesn't last long and there is no protection, and it normally causes irritation of the infant skin. It's not very, very safe for the infant skin. Those normally uses powder. Powder is not recommended because it normally traps the bacteria. And when you apply powder, sometimes you might even want that place to be moisturized. Then this one will also attract bacteria and trap them, and this can be now a breeding and space and conducive atmosphere for all those gram negative, gram positive, and anaerobes that I was talking about. Tying with threads and even with the coins, it's not normally recommended because they cause serious infection. Even the use of ash and even cow dung and even oils, cow oils, or even anointed oils, the way some people normally say to us in clinics, those are not recommended. So still advise and persistently advise that we use this chlorhexidine, because the next question people will be normally asking, how long before the umbilical stump falls off? It's very, very important question that is being asked in the clinic, the antenatal clinic. WHO range of natural falling of umbilicals is between 5 to 15 days when you are using this. When you are using this particular chlorhexidine digluconate, that range might be depending on each and every infant or newborn, but the range is between 5 to 15 days. As I can give an example with my newborn, it fell within 3 days, and most of them normally falls within 3 to 5 days. When it is passing 15 days, that is 2 weeks, when you do not see the dryness or even the stump does not shrivel, meaning it doesn't contract or even wrinkle, maybe due to loss of moisture and low blood supply because of that cord clamp that was used, and it does not even turn black, and 15 days is elapsing, then you may contact your pediatrician or your clinician or even midwife or even a nurse to verify or to check whether there is something wrong with the umbilicals. And kindly do not force the umbilical stump to fall off. Do not force it. Do not pull. When you use chlorhexidine very well, within 3 days it will just wither and fall. And when you have a newborn that is using a diaper, kindly fold the diaper down, and the umbilical stump should be above. It should be above, and the diaper should be down. The reason why we do not want you to cover the umbilical stump with the diaper is that it will attract bacteria, because it will be forming moisture. It will be so dumpy, and this one will attract those bacteria that I've been talking about. So fold the diaper down and does not go up past the umbilicals. So take note of that, and this is very, very vital just to prevent the infections. So chlorhexidine is very, very affordable. It is only 150 Kenyan shillings, that is around $1.1 $1.1 coming in terms of 10 grams, and everybody can buy this from any nearby chemist, and this is universal. If it is recommended by WHO and UNICEF, it works all over the world, because anatomy and physiology of the stump is the same whether you are African, you are in American African, or you are a European, or you are from any country. We normally recommend this cord. So umbilical cord is the baby's first connection to life. Do not mess it up. Do not forget to use chlorhexidine. Stop using powder. Stop using cow dung, spirit, or even those anointed oil, or even cleaning with water and just leaving without application of too much salt in them. This is what is recommended. If others worked for you, you can then give us a comment there. But general population, this is the best, because we normally meet even some umbilicus which has maggots. There's a lot of infection to our newborn, and we do not want this. We do not want this. We want to cap the neonatal deaths to zero. In fact, now it is zero deaths at any delivery points all over the world. Thank you so much. And if you will wish to watch any video of mine, kindly click these links and videos that are appearing here, and just give me some slight comment about this video or the comment section. See you in the next video. Muchas gracias.